Mr. Joy, your story with IgG4-related disease goes back a long way, long before we met. Can you remind me of when this started and how it started?
It happened when it started when I was 19 years old. I would have chronic sinusitis, and I would get Kenalog shots on a regular basis to free up my sinuses.
Kenalog shots in the skin and
No,
muscle?
right up the nose,
Okay.
into the sinuses.
Uh-huh.
And it got to the point where my doctor did a debulking, a surgery, to clean out the nose. About 6 months later, I had to go back for a second debulking, but they couldn't go any further without getting into the brain matter in the back of the head. So that was as far as that could go.
So they had taken away a lot of the sinus
A lot of the
tissue.
sinus tissue, so that to relieve the swelling, there's nothing left to swell.
Right.
From there, it shifted over to my left eye.
Okay.
My left eye would swell, and they would put me on prednisone, oral prednisone. And several times the eye got so big, it was like a softball size. It was humongous. And I had to go into the hospital for 3-day stays for IV prednisone steroids.
Were you still in your 20s at that time?
I was in my 20s,
Okay.
and I was a police officer at the time, so it was sort of hard on work. The prednisone drove me absolutely crazy, but what could I do?
What kind of symptoms did you have on the prednisone? Do you recall?
I would get irritable, no sleep. My kids would be afraid of me. My wife would say, "Hey, kids, Pop's on prednisone." And I grew in size-wise. The prednisone increased my body size from 150 to 250.
Whoa.
I put on 100 pounds in about 6 years, 7 years.
Oh my gosh. So you were
prednisone.
on multiple courses.
Of prednisone.
Okay.
Between the sinus, the eye, and then it progressed to my parotid gland.
Okay.
And they were still using prednisone. They were setting up for an operation on the parotid. When they did a physical, I had an x-ray done, and I had a lump-sized tumor, lymph node.
Yeah.
And they had to take that out first. They took that out. It was encapsulated, so they took the whole mass out. And while I was in the recovery room, the doctor came and told me, "Well, we got it all out, but I'm afraid you have cancer." They did a post-op test of the tumor. It was cancerous, supposedly.
So even after they looked at the tissue under the microscope,
they
told you it looked like it was cancer.
And he told me I'd see me in 2 weeks and I'd have better, more information. When I saw him in 2 weeks, it was like, "Oh, we're sorry, we made a mistake." What mistake? It's like, well, it's not cancer. We sent the sample out to 2 labs in Bethesda, Maryland. I'm guessing one was NHI, National Institute of Health.
Yeah.
And I don't know who the other was, a military lab. And
Bethesda Naval Hospital. Maybe.
I don't know where. And they both came back saying that's not cancerous, but we've never seen it before. It's unknown, which is great news for me because I had already seen about 40, maybe 50 doctors, and nobody could figure out what was going on.
Wow.
So I was lucky enough that my eye doctor knew an eye doctor who was the head of surgery at Mass Eye and Ear. And I saw him, and he was researching a project called pseudotumor with a Swedish doctor. And they decided to take out the lacrimal gland so that reduced the swelling.
Okay.
And that was great for a year. And that was a success according, we were thought. And a year later, everything started again. The eye started re-swelling even without the gland. And then same thing with the parotid gland.
So you had not only inflammation of the lacrimal gland, I think you had inflammation of the muscles that move the eye, the extraocular muscles, and that's why you had the swelling.
The swelling.
They'd taken the gland out, but the muscles were getting swollen, and that's why you had the recurrent swelling.
And also along with that, I started having asthma attacks. So they weren't sure what to do.
Right.
My doctor is Dr. Papliotis. He now has a friend. He said, "I have a friend over at Mass General. He's a research doctor. He's a hell of a guy. If he can't figure it out, nobody can." And he called up Dr. Block and said, "Hey, I got a patient. Can you see him?" And as a favor to him, he set me up with an appointment to see Dr. Block. He accepted me to take a look at me. And that was the beginning of my miracle, I could say.
So that was about the year 2000.
Yep.
How old were you in 2000?
I would have been 46 years old.
46 years old.
Yeah, 46.
Right. So that means you had already had the disease for
Probably
28
20 years. Yep.
28 years. And then there was another 8 years before the real diagnosis was revealed.
Right.
So you were followed for about 8 years at MGH for the diagnosis of Sjogren's syndrome.
Right.
With the parotid swelling and the lacrimal gland swelling. And you were, my recollection is you were treated with steroids and methotrexate.
Yeah, they gave me methotrexate and pills at first. And it was great, but I was progressing along to the point where I'd have to take pills, enough pills, where I'd be sick instead of 1 or 2 days with nausea. I'd have to go a whole week of being sick.
Right.
So they increased it to shots, and we started back low again, and it picked up to, again, week to week, Sunday to Sunday, being sick.
So the methotrexate is usually given by pills to start off with, but the medication disagreed with you.
Yes.
You were having nausea that was very difficult. So they switched to shots,
Right.
which is sometimes tolerated better, but even that really wasn't tolerated
It wasn't,
very
no,
well.
it wasn't helping at all.
Yeah. So it was about that time, this brings us up to about 2008, when we became aware of this disease, IgG4 related disease. And Dr. Block raised the possibility that maybe this is IgG4 related disease. We should check an IgG4 concentration. And so I saw you together with Dr. Khosrowshahi, who was a fellow with me. And I remember we sent an IgG4 level. She was in my office, and we had waited for the level to come back. And I remember looking on the computer, and it was very, very high.
My AG4s, yeah.
Right. And then we went back and we looked at some of the biopsies you had had. We looked at that lymph node that had been taken out. We looked at the lacrimal gland and the parotid gland biopsy, and even I think you'd had a biopsy of the extraocular muscles.
Yes.
And all of that pathology with the knowledge of the retrospectoscope showed that it was IgG4 related disease. So the very high serum IgG4 made great sense in the context of your long course and the organ involvement that you had had. And so that means 38 years after you started with your symptoms, you finally had the right
Finally found something that worked.
diagnosis.
And it was like God gave me my life back.
Yeah. There were a couple of other events around that time, and you remember this as well. You remember our showing you the picture of the first patient in medical history thought to have IgG4 related disease, this German patient from 1892, and you looked just like that patient.
It looked like my twin brother if I had one. I couldn't believe it. My wife couldn't believe it.
Because at the time you had a mustache.
Yep.
A really stylish mustache. And it was just like that 44-year-old German farmer described by Miklich.
That was before I turned gray.
And we thought, how could we have missed this for so long? Mr. Joy looks just like Miklich's patient.
Yep.
How did we miss it? So then once we realized what you had, we decided to treat you because we had an inkling that this disease might respond to a B-cell depleting agent. One of the products of B cells, IgG4, was very high in your case. And we had some previous experience with B-cell depletion for another disease, and it had worked very well in that disease. The prednisone had caused you to gain 100 pounds and have other side effects. The methotrexate was causing nausea and wasn't working. You were still having active disease. So we decided to try B-cell depletion. We decided to try rituximab. And then I was in my office with Dr. K. You got the rituximab and came back to see us a couple of months later after having your blood work done. And I remember hitting return on the computer so we could see your IgG4 level, and my jaw dropped because your serum concentration had fallen from about 1,500 to 360 just in a couple of months. So I remember turning and looking over my shoulder at Arazu and saying, wow. And then we said, let's go see Mr. Joy. And we walked in the room, and 2 months after getting rituximab, your parotid glands had gone from here to here.
My face was back.
Dramatic improvement. And you were the first patient to receive B-cell depletion for treating this disease.
It was wonderful, believe me. I didn't know what to expect. Block was with me the whole way, and and I was afraid of what it was going to cost.
Right.
I guess he went to the hospital and they agreed to pick up the treatments if my insurance didn't.
Right.
So that was for me, because I was on patrolman salary, I needed help.
Right.
So that was a wonderful thing that the hospital did for me that got me in through this whole period.
Right. So tell us, bring me up to date on what's happened since 2008.
Since I've started, I've been in remission twice, which was, went 3 years in remission.
So you got the 2 treatments and you were in remission for 3 years.
Actually, I think I had 4. Mm-hmm. I was maybe just 2, I don't remember how many, but I went into remission for a 3-year period. Mm-hmm. And I knew when I was out, because my sinuses started bothering me, my eyes, my asthma was back, and I went to the doctor and says, hey, can you do a blood test? And it showed the levels coming back up. Mm-hmm. So we waited until they got up pretty good, and we did another treatment, a series of treatments. It's all I needed. I was back into remission for 3 years again. And just recently, I fell back out. This will be my 4th treatment coming up.
Okay.
And hopefully we're back in remission. So far, so good.
Yeah. Wow.
The treatments have been wonderful. I have no side effects at the treatments.
So you haven't had to be on prednisone?
No prednisone.
No prednisone for 17 years
Yep.
now.
No inhalers.
No methotrexate, no inhaler. So even your asthma
Yep.
has improved, and your sinus symptoms improved.
Everything has been improved.
And your parotids are normal.
Yep.
No eye swelling.
I got my life back, because before that, I was looking at early retirement. Mm-hmm. I was having trouble performing my job. I have always had standard trucks, mm-hmm. and I couldn't even shift my truck, the clutch of my truck. So I was looking at trading that in before these treatments started. It gave me my life back, and no ifs, ands, or buts about it.
How is it that you couldn't drive your truck?
The joints, my leg pain,
mm-hmm.
I had no strength.
Oh, okay.
So
I wonder whether that was due to prednisone.
I don't know, but once I started the treatments, and without the prednisone, that type of stuff went away. Mm-hmm. Just a good side effect, or a lucky side effect in my case.
And we've been able to diagnose your recurrences, your flares, the returns of disease, mostly by looking at blood tests.
Blood tests, right.
And then generally retreating you before you have clinical symptoms. Right. So we've gotten smarter about managing the disease.
You guys have been great. And I have a hospital up near me now that can do the blood work, mm-hmm. which saves my travel, 2 hours travel, but I'll happily travel 2 hours, believe me.
Yeah. Well, we can't thank you enough for being brave enough to undergo a new therapy and to have stuck with us through the years now and really helped us learn to manage other patients better in addition to yourself.
I can't help thank you guys enough for standing behind me. You've given me support. I've never met a bad doctor, a bad nurse here. I've always had great support, which makes a big difference in taking those treatments, because I was scared. After all those doctors refused me methotrexate and the prednisone treatments, I was worried about what was going to happen. So you guys were very thoughtful, and it's great, which made it happened, what's happening today with me.
Well, I can't tell you how many times I have told your story and how many times I have showed your picture juxtaposed with the picture of Miklich's patient, and it really helps drive the lessons home of this disease, to be able to bring the facts of this disease back to a specific patient, the first patient to receive B-cell depletion therapy.
Thank you, Doc.
All right. Thank you, Mr. Joy.